objects. We're not external objects. We're in here. So this definition from here. Yeah.
Sarah, there's people around the edge who may not.
Oh, sorry. Oh,
Right.
Viktor.
Oh, thank you very much, Sarah. You posed an interesting paradox. Well, I think it's a shame we glossed over it. The paradox being that depression gets more common in times of economic recession and crisis, but not in times of war. Why? I would suggest the great difference is, in times of war, we were united as a nation and working together towards a common purpose. There was a feeling of unity and being all in it together. In times of economic crisis, well, some people suffer a recession. Of course, throughout the economic crisis and recession, some people have been doing very well for themselves. They've been doing handsomely for themselves, according to phrase. And, of course, in times of economic crisis, because you're being repossessed, it doesn't necessarily mean your neighbours are being repossessed, so you're on your own. So the crucial difference is a question of isolation. I believe that isolation is a crucial part of the slippery slope towards depression. And having said that, why is there so much depression about? Another factor may be the rise in narcotic and alcohol consumption. As we know, governments have moved to legalise 24-hour drinking in bars and so forth, which ties in very nicely with the latest point about commercialisation and materialism, because a lot of these big brewers are big donors to the major political parties, keep them going. So obviously, as we saw with the Bernie Ecclestone and cigarette advertising scam, when they give money to politicians, they expect politicians to give them something back. And in the case of the brewing industry, it's being able to open their pubs for 24 hours, stop people drinking in the streets, make them pay through the nose and drink inside the pubs instead, so they can make more profit. The sad other factor is, of course, we've had a closure of mental health drop-ins. This increases isolation. It's rather intriguing, actually, because David Cameron has said that he hasn't cut the health budget. That's what he says. But when I go to meetings for commissioners, I find that the budget available for drop-ins has decreased. So where has the money gone then if the money hasn't been cut? How come drop-ins are constantly being cut if the health service money isn't being cut? Well, once again, we come back to the point about greed. What we now have is an attitude whereby we're seen as cheap labour. And where in organisations like First Step Trust emerge, a modern day version of the workhouse that puts people with depression to work for a few pence an hour. They claim they're doing them a favour because if they earn any more it would affect their income support. And these organisations are coining in millions. They're paying their top directors six-figure salaries, and they're even creaming off money from the health service that is needed for drop-ins for us by getting the health service to commission them.